Hello everyone, Dr. Alan Mandell here. Welcome back to my channel, Science of Healing. You know, most people think cataracts are just a normal part of aging. A little blur here, a little glare there. I'll deal with it later. But the truth is, cataracts are not just a nuisance. They're a warning sign that your eyes need attention. And the sooner you act, the better your vision and your quality of life. You wake up in the morning and reach for your glasses, and the world feels off. A little fuzzy, a little dull. You blink, you rub your eyes, you think maybe it's just tiredness. But what if it's more than that? What if your eyes are sending you a warning, a quiet alarm that something precious is slipping away? Cataracts are the leading cause of vision impairment worldwide. According to the World Health Organization, more than 65 million people over the age of 50 suffer from them, and yet most wait until it's too late to act. The first sign is often something subtle, almost invisible: blurred vision. Objects that once seemed crisp and clear now have a soft, hazy outline, as if a fog has settled over your eyes, and it's not just a minor inconvenience. Studies have shown that even mild vision loss can increase your risk of accidents and falls by over 50%. That's not fear-mongering, that's science. When your eyes fail, your body pays the price. And then comes the glare. Streetlights, headlights, the harsh glare of a sunny day, it hits you like a wave, blinding, uncomfortable, sometimes painful. Research published in the American Academy of Ophthalmology shows that cataracts scatter light inside the eye, creating halos and double vision that make night driving a minefield. You may think, I can manage. I'll avoid driving at night. But each decision like this chips away at your freedom, your independence. Each time you squint, each time you hesitate before crossing the street, you are paying a hidden cost, a cost that grows every day. But cataracts don't announce themselves with drama. Often they sneak up slowly. Your prescription changes again and again. You pop in new lenses, thinking they'll fix the problem, but the blur persists. You may wonder if your eyes are just aging, if it's normal to see less sharply. The truth is, the natural lens inside your eye is clouding, and no glasses or contact lenses can restore what's being lost. This isn't a small detail. Studies indicate that people who delay surgery beyond the point of noticeable vision loss suffer greater long-term visual deficits, making recovery slower and more complicated. And then there's color. The world begins to look muted, washed out. The vibrant red of a ripe apple, the deep blue of the ocean, the bright green of fresh vegetables, all duller than they once were. Scientists have discovered that cataracts act almost like a yellow filter over your eyes, absorbing certain wavelengths of light and shifting your perception of color. You might not notice it at first because our brains are incredibly adaptable, but slowly life loses its vibrancy, and with fading color comes fading joy. Everyday pleasures like cooking, gardening, or even reading your favorite book start to feel off. The world is still there, but it's less alive. You might brush it off as a normal part of aging, but ignoring these signs comes at a cost. Cataracts have been linked to a higher risk of depression in older adults. Losing the clarity of your vision is not just a physical change, it's emotional. It affects confidence, social interaction, and mental health. Every time you avoid a social gathering because you can't see well enough to navigate, every time you give up a hobby you love, you are letting the cataract steal pieces of your life. The science is clear. Early recognition is critical. Ophthalmologists use precise measurements like slit lamp exams and visual acuity tests to detect cataracts before they become severe, but you don't have to wait for a doctor's appointment to notice the warning signs. Pay attention to your everyday vision. Notice if reading the newspaper requires extra light. Notice if driving at night has become stressful. Notice if colors seem duller, glare more pronounced, or faces harder to recognize. These are not inconveniences. They are alarms. And here's something shocking. Cataracts don't just blur vision, they can accelerate the decline of other senses. A study in the Journal of the American Geriatric Society found that older adults with untreated cataracts have a higher likelihood of developing mobility issues and cognitive decline. Your eyes are not isolated organs. They are gateways to how your brain perceives the world. When your eyes fail, your brain is forced to work harder, adapting to incomplete information, which can increase mental fatigue and confusion. Recognizing the signs early isn't just about seeing clearly. It's about preserving your autonomy, your safety, and your quality of life. Cataracts may seem inevitable with age, but science gives us the power to act before it's too late. The sooner you identify the warning signs, the sooner an ophthalmologist can evaluate your vision and discuss surgical options that are safer and more effective than ever before. Modern cataract surgery has evolved into a quick, minimally invasive procedure with over a 95% success rate in restoring vision. But that opportunity only exists if you notice the fog settling before it becomes impenetrable. Some people wait, thinking their vision loss is minor, thinking, I can manage. But life does not pause. Roads don't get brighter at night. Colors don't become vibrant again on their own. Every day spent ignoring the subtle changes is a day that life becomes less clear, less joyful, less safe. So start paying attention. Observe how your eyes interact with the world. Notice the blur, the glare, the shifting colors, the strain of focusing. Recognize that these are not trivial inconveniences. They are signals from your body demanding attention. And understand this, you are not powerless. Early detection is your strongest weapon. Every consultation, every eye exam, every small adjustment you make today can protect your vision tomorrow, because the truth is simple. Your eyes are more than organs. They are windows to your life, to the people you love, to the experiences you cherish. And the warning signs, they are not there to scare you. They are there to guide you, to tell you that it's time to act, to reclaim the clarity, the color, and the freedom that cataracts threaten to take away. Don't ignore them. Don't delay. The moment you recognize the warning signs is the moment you take control. And that clarity of sight, of safety, of life itself is waiting for you on the other side. Imagine driving home at night. The road is quiet, the world dimly lit by streetlights. But as headlights approach, you flinch. Bright halos appear around every light, glare spreads across your vision, and suddenly something as simple as driving becomes terrifying. Night driving, something most of us take for granted, can turn into a dangerous, anxiety-filled ordeal. And for millions of people with cataracts, this is the reality every evening. Cataracts do more than blur your vision in the daytime. They scatter light inside the eye, creating halos, glare, and double images that turn night into a minefield. Research from the American Academy of Ophthalmology shows that this scattering effect is not just inconvenient. It significantly increases the risk of car accidents, with older adults being disproportionately affected. Glare is more than a nuisance. It is a biological alarm telling you that your lens is no longer clear. Cataracts disrupt the normal passage of light, causing it to spread in all directions. Your brain tries to interpret this scattered information, but the result is distorted vision and an overwhelming sense of disorientation. Studies reveal that drivers with untreated cataracts are twice as likely to be involved in nighttime crashes compared to peers with clear lenses. It's not an exaggeration, it's a statistical reality, and it's preventable. This problem doesn't only affect driving. Walking outside at night becomes a challenge. Streetlights create halos that confuse your depth perception. Oncoming cars seem brighter than they should, forcing you to shield your eyes constantly. Even indoor lights can appear harsh, washing out colors and creating discomfort. The Mayo Clinic reports that glare from cataracts is one of the top reasons older adults avoid social activities after dark, leading to isolation and depression. What starts as a physical limitation quickly becomes an emotional and social burden. And yet, people often dismiss these early warning signs. They say, "I'm just sensitive to light," or "everyone squints at night as they age." But science tells us otherwise. Cataract-related glare is caused by structural changes in the lens itself. The lens becomes opaque and light is no longer focused correctly on the retina. This scattering effect not only reduces visual clarity, but also increases visual fatigue. Your eyes work overtime to compensate, leading to headaches, eye strain, and chronic fatigue that most people never connect to vision loss. Imagine trying to read a book under a dim lamp, only to have every letter blur and shimmer in the light. Imagine cooking in your kitchen at night and misjudging the depth of a knife because the glare from overhead lighting is disorienting. Everyday tasks suddenly become stressful, exhausting, and unsafe. And all of this is happening silently, without pain, without dramatic warning signs, until the effects accumulate and life begins to shrink. Scientific studies have even linked poor night vision from cataracts to higher rates of falls in older adults. When your eyes cannot accurately gauge distances in low light, your brain miscalculates steps, curbs, and stairs. A study published in the Journal of the American Geriatric Society found that adults with significant lens clouding were 1.8 times more likely to experience a fall, even in familiar environments. Every shadow, every glare, every distorted reflection becomes a potential hazard. This is not just about seeing clearly, it's about survival and independence. What makes this worse is that cataracts often progress slowly. You may not notice the change night by night, but over months, the accumulation of haze and glare becomes debilitating. By the time you consciously realize there's a problem, your daily life has already been compromised. Simple pleasures like evening walks, dining out, or attending concerts become sources of anxiety instead of enjoyment. Your world starts shrinking with each passing day, a quiet thief stealing experiences without ever touching your wallet or your schedule. But here's the hope. Modern cataract surgery can restore night vision and eliminate the glare that has stolen your confidence. According to research from the National Eye Institute, patients report a dramatic reduction in halos, glare, and light sensitivity within days of surgery. Streetlights regain their normal brightness. Oncoming headlights no longer feel like blinding lasers. Driving, walking, cooking, even reading under dim light, everything becomes safer, easier, and more enjoyable. And the impact isn't just physical. Studies consistently show that patients who regain their vision report improved mental health, increased social participation, and a renewed sense of independence. Nutrition and lifestyle choices can support your eyes as well, even before surgery. Antioxidants like lutein and zeaxanthin, found in leafy greens such as kale and spinach, accumulate in the lens and retina, helping reduce oxidative stress that accelerates lens clouding. Vitamin C-rich foods like oranges, strawberries, and bell peppers strengthen lens fibers, potentially slowing progression. Omega-3 fatty acids from salmon, flax, and walnuts reduce inflammation in the eye, protecting retinal cells and supporting overall visual health. These choices won't replace surgery, but they give your eyes resilience, preparing them for better outcomes post-operation and slowing further deterioration in the meantime. The warning signs are clear. If night driving is stressful, if glare from lights overwhelms you, if shadows and reflections make navigating simple spaces difficult, these are not trivial complaints. They are signals from your body that your eyes are struggling. Ignoring them puts you at risk of accidents, injury, and a shrinking quality of life. But paying attention gives you the power to act. An eye exam can reveal the extent of lens clouding, and timely surgery can restore clarity, confidence, and safety. Cataracts may be common, but they are not inevitable in terms of their impact on your life. You don't have to resign yourself to blurred lights, dangerous glare, or dimmed evenings. The moment you acknowledge the warning signs is the moment you reclaim control. Modern surgical techniques are fast, safe, and highly effective. Patients walk out of the clinic seeing the world in vivid detail, once again marveling at colors, contrasts, and light the way they haven't in years. So don't wait. Don't brush off the halos, the glare, the fear of night driving. Listen to your eyes. They are telling you something important. Night vision and glare issues are more than minor annoyances. They are early alarms that action is needed, and every step you take to recognize them, to consult an ophthalmologist, and to consider surgical correction is a step back to safety, independence, and the full richness of life. Because your nights, your evenings, your safe passage through the dark, and your peace of mind are worth acting for today. Cataracts may cloud the lens, but they don't have to cloud your life. The difference between a world of shadows and one of clarity starts the moment you notice the warning signs and take action. Your eyes are telling you the truth. Listen to them. Have you noticed it? The world doesn't look quite the same anymore. That bright red apple on the kitchen counter no longer pops. The golden hue of a sunset seems dull, muted, almost gray. Your favorite flowers, the vivid blues, greens, and yellows that once made you pause and smile, they don't sparkle the way they used to. You might think it's normal aging, that life is just losing its color, but the truth is, it's your eyes sending a warning. Cataracts don't just blur vision, they steal the richness, the vibrancy, the very soul of how you see the world. Scientific research shows that cataracts act like a yellow or brown filter over the natural lens. They absorb certain wavelengths of light, skewing your perception of colors and leaving everything washed out. It starts subtly, often unnoticed. A friend might say, "That flower is bright red," while you see something closer to faded orange. Your brain tries to compensate, but over time, the mismatch grows. Colors fade, contrast diminishes, and the world slowly becomes less vivid. According to a study published in the journal Ophthalmology, nearly 80% of patients with early cataracts report diminished color perception even before sharpness of vision is affected. It's not just about seeing clearly, it's about losing the emotional impact of the world around you. Colors are not trivial. They guide us, they energize us, they trigger memories, emotions, and even appetite. Imagine preparing a meal and not realizing that the bell pepper you just sliced isn't fully red but slightly muted because your eyes can't detect the full spectrum. Or looking at your grandchildren's drawings and not seeing the brilliance of their imagination because the lens of your eye clouds the colors. The loss isn't just visual. It's emotional, psychological, and profoundly personal. And the impact extends far beyond aesthetics. Research shows that reduced color perception can affect safety and cognitive function. When colors fade, distinguishing objects in your environment becomes harder. Traffic lights, warning signs, medications with color-coded labels, all of these rely on accurate color perception. The Journal of Vision reports that older adults with cataracts are more likely to make mistakes in tasks that depend on color discrimination, from identifying ripe fruit to reading important labels. Everyday life becomes a minefield when your world loses its natural cues, and yet many people ignore this silent thief. The psychological effects are just as significant. Studies in ophthalmic journals link cataract-related color loss with higher rates of depression, anxiety, and social withdrawal. Life becomes less engaging, less stimulating, less joyful. Your favorite hobbies, painting, cooking, gardening, photography, start to feel frustrating or uninspiring. You may not even realize that the vibrant world you once loved has been dimmed because of your own eyes. Colors carry emotion, energy, and life itself, and when they fade, so does a part of your connection to the world. This fading of color is not irreversible, but early recognition is key. Cataracts progress slowly, and the lens gradually becomes more opaque over months and years. The moment you notice dull colors, the moment life starts to feel muted, is the moment your eyes are telling you, it's time to act. Ignoring this warning allows the clouding to intensify, making surgery more complicated and recovery longer. But when addressed in time, modern cataract surgery doesn't just restore sharpness, it restores the full spectrum of color, bringing back the vibrancy you thought was lost forever. Imagine stepping out after surgery for the first time. A bright blue sky stretches overhead. The green of freshly cut grass leaps from the ground. Flowers, cars, clothes, every object pops with clarity and vibrancy. Studies tracking patients before and after cataract surgery show dramatic improvements, not just in visual acuity, but in color perception. Participants report that life feels richer, more vivid, and more emotionally engaging. The world that once seemed dull and muted suddenly bursts into life, as if someone has turned the color dial back to its true setting. Nutrition also plays a role in supporting this process, both before and after surgery. Lutein and zeaxanthin, carotenoids found in kale, spinach, and other leafy greens, accumulate in the lens and retina and help protect against oxidative stress that contributes to cataract formation. Vitamin C, abundant in citrus fruits, bell peppers, and strawberries, strengthens the lens fibers and helps maintain clarity. Omega-3 fatty acids from salmon, walnuts, and flax seeds reduce inflammation in the eyes and protect the retina. While these foods cannot reverse cataracts once they are advanced, they can slow progression and support recovery after surgery, helping your eyes regain not just clarity, but vibrancy. The fading of color is a silent thief because it creeps in gradually. One day you realize the world isn't as brilliant as it once was. That's the moment to pay attention. Don't dismiss it as just getting older. Don't wait until your vision is so compromised that even routine tasks feel difficult. Early action, scheduling a comprehensive eye exam and discussing surgical options, can reclaim not just your vision, but your experience of life itself. Cataract surgery today is precise, quick, and remarkably safe. In less than 30 minutes with local anesthesia, an experienced ophthalmologist can remove the clouded lens and replace it with a clear artificial lens tailored to your needs. Within days, patients report restored clarity, reduced glare, improved night vision, and, importantly, vibrant color perception. The world returns to life in full spectrum. A sunset, a bouquet of flowers, a child's artwork, everything regains the richness you may have forgotten existed. Your eyes are more than organs. They are your connection to the world, to emotions, to memories. When colors fade, life loses its intensity. But when you recognize the signs, when you act before the clouding is severe, you take back control. You take back not just your sight, but your engagement with life, your joy, your ability to experience the world in its full richness. Cataracts are common, but they are not a sentence to dullness. Science and modern medicine give you the tools to restore your world, to turn the brightness, the saturation, the vibrancy back on. So, pay attention to the colors you see. Notice when the reds aren't as red, the blues aren't as deep, the greens aren't as lively. These are not trivial complaints. They are early warnings that action is needed. And when you respond, when you consult an ophthalmologist, when you consider surgical correction, you reclaim life in its full spectrum. Your world, your experiences, your memories, they deserve to be seen in vivid color because every hue, every shade, every tone is part of what makes life beautiful. And with the right action, with the right timing, you can bring it all back.